Hi, I'm Rich Miller. At Virtua, we believe citizens need to be informed about the important healthcare issues affecting their lives. That's why we're proud to support healthcare programming produced by the Caucus Educational Corporation and their partners in public television.
Living with postpartum depression, next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by Virtua, South Jersey's comprehensive healthcare system; Roche, Horizon Blue Cross Blue Shield of New Jersey, making healthcare work; and by Verizon Communications.
Welcome to Caucus, New Jersey. I'm Steve Adubato. What exactly is postpartum depression? And how is it different from what has been called the baby blues? Joining us right here in the studio is a panel of experts to help us understand this often misunderstood topic. We have Dr. Thomas Kay, Medical Director of the Virtua Women's Program of Excellence and an OB/GYN physician. Erin, recovered from postpartum depression and is here to share her story. Marti, a social worker and facilitator of the Perinatal Depression Support Group at the Monmouth Family Health Center. Dr. Lauren Eisels is a licensed clinical psychologist and group facilitator of the Barnabas Health Postpartum Depression Support Group. Doctor, did I get your name right? Mm-hmm. I want to make sure I do. Misunderstood, doctor. By the way, log on to our website. We'll hook you up with the folks at Virtua because they have some terrific information on their website about postpartum depression. That is what it is there for, folks. Healthcare organizations are doing more and more to provide this kind of educational information. Doctor, what exactly is it and why are we so misinformed, ill-informed?
Well, I think postpartum depression is a real depression. I think the problem and the misinformation out there is that most ladies go through what is referred to as the baby blues to some extent.
What's the difference?
The difference is really in intensity of symptoms and how long they last and sort of what's required in order to get through the process. In this day and age, particularly I think with women who are a little bit older, having their children and used to having a career, when a baby comes into the world, it turns your life around. And I mean, it interferes with your sleep, it interferes with your routine. And so it's obviously going to upset people to a certain extent. But the symptoms are generally milder and they tend to last a shorter period of time. On the other hand, for some people, and the estimates are roughly around 15% of the population that delivers, they really get severe symptoms that... Name some of them. And by the way, we're not going to do all of them. We'll have them on our website together with Virtua, but what are some of them? I mean, they may have difficulty sleeping, they may have eating issues, they may have anxiety, stress, they oftentimes have very emotional problems with emotional ability. How about not wanting to hold a baby? Oftentimes that's part of it, and it becomes then a real bonding issue with the child. And not wanting to hold the baby, there's a certain amount of then feedback that actually then makes them feel more inadequate and just feeds the whole process. A lot going on there. Let me ask you, Erin, you're Brandon, 6.5 years old? Yes. Okay. Your husband knew right away that with Brandon, your child, that something was up. What was it?
I think my postpartum started probably the day after I delivered. I didn't want to hold the baby. That comment really hit home with me. I just didn't feel maternal at all. And I was, I guess, sort of in denial about having a baby. It was sort of like not real, and that gradually, you know, proceeded to me just crying, I mean, uncontrollably all the time. It definitely affected my sleeping and eating patterns.
Had you wanted to have a baby?
We tried for 3 years to have a
boy.
baby.
Something you really wanted. How confused were you by your feelings?
Well, I think once I was able to get over the idea that there was something wrong with me, I was fortunate enough to be screened for postpartum depression. So I actually had a doctor contact me about a week after I delivered to touch base with me to see how I was doing. And based on my score, she knew that something was wrong. So I was really lucky that I had early intervention and I was able to get the help that I needed. So that was really the big piece for me, was having that someone reach out to me, because I think before that I would have thought, I'm a bad mom, there's just something wrong with me.
Does stigma matter to you? Were you
A
caught
great
up in the
deal.
stigma? It
A
did.
great deal.
That early intervention was huge.
It was enormous. It saved my life. It saved my marriage.
Early intervention, the exception or the rule?
I think it's gotten to be more of the rule because they're doing screening now with new moms in New Jersey. But still, there's a lot that's overlooked because of stigma. And especially new moms don't know what to expect. So
Now you had, excuse me for interrupting. Doctor, you had it
yeah,
with both of your children.
yeah,
Did you know it right away?
no.
And you have a clinical background.
Yeah, I never studied this in graduate school.
Oh boy. What did you think was going on?
I didn't know. I started to think it, but with postpartum depression, you'll have periods of feeling better and then worse. So you don't exactly know until it gets really bad. And so my family didn't really know either.
Who was there for you?
My husband was there for me.
How important was that?
Huge. Huge.
And for you, by the way, Erin, your husband?
Very supportive.
Is that often, Marti, the case? Always the case? Well, it's obviously not always, but...
No, most of my patients,
Yeah, describe your situation.
okay, I work for a federally qualified health center.
An FQ?
An FQHC in Long Branch, Monmouth County, New Jersey.
Right. We're not talking about rich folks here.
No.
Go ahead.
Most of my patients are uninsured, or they are low income and they've qualified for New Jersey Family Care, so Medicaid will cover most of their expenses.
Significant portion Latinos?
Most of them, yes.
Does that matter in this discussion?
Yes, it does.
How so?
Well, if the patient does not speak English, I only have one provider in the county that we can refer to for any services. And the provider is in an area that is not easily accessible from public transportation. And
Go ahead.
sometimes the wait as well. If I have to refer someone 4 months, 5 months, if I'm going to refer them over to our local hospital. And if they are in their first trimester or their second trimester, I cannot refer them.
So think about this. Now, you were treated. Now, you're, right?
Yes.
You were treated through a first-class operation, right?
Absolutely.
Okay? You got earlier intervention. Could you, I saw you shaking your head when she was talking about that. What were you thinking about some of these patients who are not getting the help that Erin got?
Well,
What's happening for them?
I think the issue is that, you know, there's a significant segment of the population that just does not have access to the kind of treatment that you would like these people to get. And as was mentioned, you know, the earlier you intervene, I think the better results you have and the easier it is to deal with the problem.
What happens when it doesn't happen?
Well, when intervention doesn't happen, you don't know what's going to happen.
Okay, you don't
He's
get the
gonna
medication. You're not getting the psychological counseling you need. Obviously, the situation's getting worse. The woman is at risk, greater risk. Is the child at greater risk?
Yes.
Listen, I don't want to play worst case scenario, but we are talking about some horrific situations here, correct?
Possibly.
Okay. So my question is, for the rest of us, and we've had 4 kids, okay? Let's go through this in the spirit of being helpful, in the spirit of trying to provide a public service, which is why we got into this public broadcasting business in the first place. Some advice for, because we'll go through this, family members and then friends and others. Advice for husbands. Some advice for husbands looking for, wanting to be helpful to their wife or the woman in their life who is giving birth to a child.
I guess talking to them and listening to how they're feeling and noticing if they just don't seem like themselves. My husband knew that there was something that was off, even though it wasn't consistent.
Did he approach you?
It was a back and forth thing. I'm pretty verbal about how I'm feeling. So,
That's a good thing.
yeah, it's a good thing. But yeah, just being there and listening and being proactive.
How about friends? Did you talk to them?
I was new to the area with my daughter, so I didn't have that many friends. A couple of people, but my husband was really the one.
So he was a key.
Yeah.
Did you talk to friends?
I was fortunate enough to have a friend who had gone through postpartum depression.
Did you go to her?
I did, and she would call me 3 times a day,
Wow.
every day. How are you doing? How's the baby? Let me take the baby. Extremely helpful. I often refer to her as my angel.
You know, Erin just triggered something, support groups. How critical?
It was
Very
huge for
critical.
me. It was huge.
Is there a Virtua-related support group?
Yes.
Yes.
Describe it, doctor.
It is a group of women who have dealt with or are dealing with postpartum depression, led by someone who is trained to do that.
Right.
And it allows, I think for one, I think you tend to, and I'm speaking from the man's side of it since I can't be appreciated from that side of it, but basically the fact that there are other people out there that are doing this, that it isn't something that happens because you're weak or you're unable to control things, and it allows you to sort of get your emotions out in a forum where you're not going to be judged. I mean, I think one of the big problems with postpartum depression in even seeking out talking to your friends is, you know, that oftentimes people are very judgmental about
Still?
what goes on. I think
We
still.
had a former first lady in this state, Mary Jo Cody, who publicly talked about it. We've had other very prominent women who've talked about it. Does that matter? Has that it made the stigma any less significant?
Well, I think it's brought the topic more into light because although people have always spoken about it, the women were not as open to admit that it happened. And still to this day, you're still going to have the family members or the friends who say, oh, please, get over it. Just wait.
Oh, please get over it. Did you get that?
I was told to suck it up
Oh, come on. By people who mattered to
by
you?
family members. That
Can I-
just
can I-
didn't know what else to say.
How did you respond?
I took it personally. I thought, you know, it sort of added to the whole idea that I was a bad mother. You know, postpartum depression is the antithesis of how you're supposed to feel when you have a baby.
Incredible joy,
Yeah.
fulfillment, and you're feeling something else.
I'm feeling suicidal. I'm feeling like I don't even know if I love this child.
Suck it up.
So glad I didn't.
But the worst thing, did you get any of that? You did too.
Yeah.
And these are people who love you. And by the way, folks, log on to our website. We'll hook you up to the Virtua website, give you valuable information, including information about the support groups. No matter where you live in the state, you need to understand where the support groups are, because sometimes family and friends don't get you what you need. And frankly, no disrespect, but sometimes they can make it harder. Do some of the folks come to your place saying that those closest to them are making it harder?
That those what?
Those closest to them are making it actually harder.
Sure, because this is the time that the woman's supposed to be super happy. She's supposed to be joyful. She's supposed to be bringing a baby into the house, and she's supposed to be happy.
Should the friend, I was going through this before, the husband, now friends, should friends potentially, because Erin said this before, that one of your friends who had gone through it actually was a lifesaver. Should a friend go in and say, listen, let me take the baby. Let me take the baby. for a couple of hours. Should a friend be that intrusive, doctor, and do that proactive? I know it depends upon a whole range of factors.
Well, I think
if they're that concerned.
Yeah, I think if they're that concerned, sure. I think you know, anything that you can do to help is important. I mean, you're dealing with something here that is a significant problem, and you know, eventually, in some situations, may lead to something happening to that baby.
Potentially suicide, something
Right.
happened to the child. Say the woman says, no, I'm fine. At a certain point, a friend and or family member has to really push the envelope, because how does someone who is sick know that she is sick? And my point is, sometimes it does require reaching out for professionals who know more than any one of us, correct? Am I making too much of this, Erin? Help me.
Absolutely. I joined the support group and
At Virtua.
At Virtua, and I was around, so I was seeing a therapist outpatient, but I was also around someone who was running the group, a professional who was running the group, as well as other mothers who were going through similar experiences.
What was that doing for you?
It was huge. I didn't feel like, I didn't feel alone, and I didn't feel like I was a bad mother. I think that was probably the two words that rang in my mind the most were bad mother, which was really heartbreaking because we wanted so much to have a child.
Given the fact that you've experienced this personally, and that you do what you do clinically, how has it helped you?
Oh, it's huge.
Talk about it.
I know physically what it feels like, what it feels to have the depression come over you, all the experiences, the symptoms, medications.
Is it, by the way, is it biological, physiological, a chemical issue, doctor?
Well, I think most people think that it is related to a multitude of factors. I mean, probably one of the big things is tremendous hormonal changes occur right after you've had a baby.
Excuse me, before you go any further, women who are older, if you're 38 as opposed to 28, more likely, less likely, irrelevant?
I think from a physiologic standpoint, I think it's probably somewhat irrelevant. On the other hand, I think what we see is the 38-year-old who is basically out, has a job, is a professional, controls the situation, and because of the fact that this baby has now come in and disrupted everything. I mean, I hear all the time, I'm going to have this baby and nothing's going to change. And then I say, this is the most disruptive thing that's going to happen in your life, although it's a good disruption.
Yes.
And so I think oftentimes you'll see more problems there because of the fact that these women have been in positions of control, and you're really helpless. You know, you can't, you know, you kind of inside know what you want to do, but you can't do it. And the fact that you're not performing up to your standards is a problem.
So, by the way, so we can do justice to this, log on to our website. Again, we'll hook you up to where you can get more detailed information about some of the clinical causes based on what the research has found. I don't want to do it anecdotally here and be irresponsible in that way. Why were you smiling when the doctor was talking, when he was talking about professional women?
That was
in control.
The biggest adjustment for me was that I was always, I never had to think about anybody else but myself and my husband, and it was a complete world change when my son came along. And one of the things that doesn't get talked about a lot with postpartum depression in particular is the effect that it has on marriages.
Talk about it. My
marriage took a huge hit. Certainly not because of my son, but because of what I experienced after I had my son. My husband, as supportive as he was, and incredibly supportive, really felt powerless to help me. And we struggled through not just the hormonal imbalances, but the role adjustments that this new baby required of both of us. I went from working outside the home to being a stay-at-home mom, which we had agreed to do, and we were in agreement. And then as soon as it happened, just started thinking, maybe this wasn't the best decision to stay at home. Now I don't regret it. But at the time I thought, you lose those lifelines that you have when you do that. And when you're suffering from postpartum in particular, you need as many lifelines as you can have.
Do a significant number, do more marriages, as hard as marriage is, Jennifer, my wife, it's nothing to do with our marriage. We're doing this show right after Valentine's Day. You know I'm not talking about us. Question, do marriages tend to, do more people get divorced in any way connected to postpartum depression from experience, numbers, statistics? Why am I getting blank stares here?
I don't know if anyone's done that.
Come on, there's got to be a study on this.
I don't know of it.
Listen to what Erin just said. It wreaks havoc, it's difficult and stressful on marriages. Marriage is hard enough already, even in the best marriages.
But there's a child involved. So I think that often the marriage will stay together for a while, and then maybe down the line, you know, I'm not sure.
Where's the support groups, A, for husbands?
Yeah, husbands don't come. I tried.
Whoa,
I tried
whoa,
setting
whoa,
up
hold
a support group for husbands.
Hold on, wait a minute. You have a support group right now
Yeah.
for
two.
women dealing with postpartum.
Mm-hmm.
And you invite the husbands?
I did in the past. Now I've put it out there for the moms to ask whether the husbands would come.
Why do you think they don't?
I think logistically it's difficult for timing.
Go ahead.
And I think some of the husbands just think it's the mom's problem, and it's not their problem.
Go ahead.
They have to work.
Mm-hmm.
And then the times when the support groups take place, or the access to where the support group is,
Yes,
they
all
just can't
true,
make
but
it.
Doctor, what's your advice to husbands, men out there?
Well, I think the best thing you can tell husbands is, I mean, they probably know their wife as good as or better than anybody else, is that if you see something, intervene. I mean, our experience in our practice is half the calls that we deal with women with postpartum depression, it's the husband or significant other who makes that call.
Right.
But it's then critical that they stay involved, and it's a family problem. It isn't mom's problem.
Is it a family problem?
I think so. Yeah. I mean, it's difficult. It's difficult for the husband, but you know, you're a guy. Guys have funny egos. It's not. They don't like to admit that it's their problem too. But obviously they were involved.
Excuse me, especially when we don't know what to do. Doctor, to what extent do you talk about this with women and the significant man in their lives as they're having a baby before? Right? I mean, they're having a baby. To what extent do you put on the table the issue of postpartum depression up front?
We talk to everyone about that.
If it happens.
Well, we talked before that if, in fact, that this is an issue that can happen, there's certain populations where you have to be more concerned. I mean, certainly someone who's had a postpartum depression before, somebody who has had an outright depression not related to postpartum.
More likely?
More likely.
Got it.
People who have sort of not supportive family structures, there's problems. People who have financial, other stressors in their life that might do that. So, I mean, what we try and do is make them aware of it, and then obviously, you know, part of the thing is you now screen people as you go along.
Right.
So that hopefully if you pick it up on the screening tools ahead of time, you know, you can intervene, and then they get screened in the hospital, you know, before they go home.
30 seconds, real quick. How's Brandon doing?
He's doing great.
Great?
Oh, great. Oh, we have a great relationship now.
6.5.
Yeah. Fun age.
You guys are tight.
Very tight.
Your kids?
They're great.
How old?
15 and 10.
Doing great.
Yeah.
We're happy for both of you. We're happy for your kids. And we're very appreciative of you coming and sharing. And very appreciative of both of you as well. A great public service. Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 20 years of broadcast excellence. N13 4WNET, NJTV, and WHYY. Funding for this edition of Caucus, New Jersey has been provided by Virtua, South Jersey's comprehensive healthcare system; Roche; Horizon Blue Cross Blue Shield of New Jersey, making healthcare work; and by Verizon Communications. Promotional support provided by NJ Biz, All Business, All New Jersey, and the Star Ledger and NJ.com, Everything Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus, New Jersey has been produced in partnership with TriStar Studios.
This is One-on-One. Join me as we get up close and personal with some of today's most compelling personalities.
This is one you can't afford to miss.
Weeknights at 7 and 11:30 p.m. on NJTV and 12:30 a.m. on 13.